From WJLA 24/7 News, this is Good Morning Washington, on your side.
Well, the annual Congressional Black Caucus Conference is back here in the district, and coming up, we're discussing issues that impact the African American community and how you can take action. Stay with us. Well, this week, thousands of people will arrive here in the nation's capital for the annual Congressional Black Caucus Legislative Conference. This is an opportunity for many people to not only listen to political leaders and celebrities, but also to tackle issues impacting the African American community. CEO and President of Acessa Health, Kim Rodriguez, is here today to educate us on her initiative to bring awareness to uterine fibroids. So thank you for your time here this morning.
Thank you very much for having me.
Now, you and I have talked about this before. We both know about this topic and this issue. First, uterine fibroids are just benign tumors that happen in women of reproductive age, but they can affect your fertility.
That's right.
And we find that the issue is a lot of women, maybe this is the first time you're hearing about this when you go to the gynecologist and you don't really know what's going on. What is it that you want women to know about fibroids? What are the key points they should know?
First of all, women need to advocate for themselves, and knowing all available options, that's what the focus should be. 70 to 80% of women are affected by fibroids. Under the age of 55, and hysterectomy is actually the most common procedure behind C-section. There's 600,000 hysterectomies a year, and over half are fibroid related. So it's important for women to really understand their condition and ask a lot of questions.
So, I mean, hysterectomy, removing the uterus, is it the easiest? Is it just the most popular? Why are you taking such an extreme measure?
It's the standard of care, and there's been little change in decades.
Wow. Well, I know Acessa Healthcare, you all really advocate for laparoscopic surgeries and really just addressing the individual tumors. So when a woman goes to the doctor and he says or she says, you know, we're going to take your uterus, what is their next step?
Again, ask questions. Acessa Health is a medical device company with a minimally invasive alternative to hysterectomy. We're using radiofrequency ablation or heat to destroy the fibroid. And women can go home the same day and they're back to normal activity in just a few days.
And really preserving fertility for women of a certain age is key here as well.
Absolutely.
We also have talked in the past about the racial disparities in healthcare and the fact that a lot of African American women aren't getting proper health care.
Right.
That's something that you're very passionate about as well.
Absolutely. And we talked about 70 to 80% of women have fibroids. African American women are at higher risk.
What is that about?
The background behind it is really not known, but it does affect African American women more than white women. And unfortunately, there's racial and socioeconomic disparities in terms of the treatment of care and women's access to minimally invasive alternatives.
Recently, you launched Goodbye Fibroids.
Yes.
Tell me about this.
Goodbye Fibroids is a campaign where multiple stakeholders have come together, patients, physicians, leaders in the space, and we aim to raise awareness around the condition itself as well as the options available to all women. And our effort really is to focus on enabling women to know that they have options and to seek out what's best for them.
And that's really key. Tonight, you and I and a panel of other people, patients, doctors, will all be talking at the convention center downtown. Tell us about the event tonight that we'll be a part of.
Very excited about the event tonight. In collaboration with Tanika Gray Valbrin, who is the founder of the White Dress Project, which is a patient advocacy organization advancing awareness for women who are suffering from uterine fibroids. And together with our fantastic panel, and thank you again for joining us. We're very excited. We have patients, we have physicians, and we have leaders in the space to really elevate the conversation about the condition, but more importantly, the racial disparities for African American women who are affected by the condition and that may not be getting access to all the options that are available.
All right. Well, thank you so much, Kim, and I look forward to talking to you again more about this tonight.
Thank you very much.
All right. Have a good one.